Here's another one of our self-help tips for people with lower back pain, sciatica, and hip problems. A lot of times what we'll see is we'll see problems in the lower leg that actually affect hip, low back, and sciatica. Here's a test you can do. Go ahead and squat down for me. Now, a lot of times if your calves come up off the ground, it means your calves aren't as flexible as they could be. You can go ahead and come up from there. So you may have to work on the calf itself to help stretch it. If you have an ankle that doesn't move well or a calf that doesn't move well, a lot of times we'll have tightness here, loose here in the knees, which leads to knee problems and ligament problems in the knee oftentimes. And so it goes tight, loose, which you don't want. Hips get tight, and then low back gets loose and unstable. So what we have people do sometimes is go ahead and squat down. You can even use a chair or something and hold that position for as long as you can. You can go ahead and come up from there. In the real world, we'd have patients hold that for at least a minute. Another way to do that is some people say, hey, I use a moisturizer cream on my face. It has to be on for a minute. Why don't you squat while you're waiting? Same thing. Commercial comes on TV. Why don't you squat down while you're waiting and do that? The longer you can hold that, the better. You stretch out your calves, and you get your whole lower extremity a whole lot more flexible and less likely to have back, hip, and sciatica problems. Stay tuned for more tips.